Welcome to the Think and Grow Well Show. If you allow your doctor, your insurance, or your Uncle Sam to define healthy, or you blame someone else for the way you feel, or you seek the fountain of youth in a prescription bottle, at a needle tip, or along the scalpel's edge, then be advised. You are about to be offended. You should probably leave now.
Anybody can just think and feel better? That's scary. I mean, thoughts aren't regulated by the feds, and no drug company has a patent on them. So thinking thoughts must not be very safe or effective.
If you love feeling frisky and having fun, take responsibility for your own vitality, and want freedom to enjoy epic experiences with folks you love, welcome aboard and prepare to be blown away. The Think and Grow Well Show starts now. Here's your host, Dr. Lori Barr.
Have you ever really thought about the word disease? Break it down now. Dis-ease. Dis typically means abnormal or bad. Ease is the natural state our body longs for. You know, if you're an active thinker and you're engaged in living and you're moving towards your life's purpose, you're much less likely to be distracted by dis-ease or disease. When we fill our hearts with stress, hatred, jealousy, or engage in strife, we're much more likely to feel it in our body. This feeling is distress. Distress. The opposite of distress is eustress or normal stress. You know, in order to grow and get stronger, stress does have to be applied. Eustress is felt after activities that recharge and revitalize us. Let's talk about some physical signs of distress and eustress in the body and how they affect the different measurement parameters that can be measured in your body. If we look at blood pressure, distress increases blood pressure, eustress decreases blood pressure. If we look at heart rate, distress increases heart rate and can make it more variable than usual. Eustress slows the heart rate and typically makes it more steady. Skin responds to distress by becoming cold or moist or both. Skin responds to eustress by feeling warm and dry. In distress, our alertness is heightened and we move into a fight or flight response, a survival response. In eustress, our alertness state varies. We sometimes let our guard down. In distress, our bowel and bladder becomes irritated and agitated. It may want to empty. We may feel nauseated. We may have an increased urge to go number one or go number two. We may have an increased urge to defecate or urinate. And we may have decreased digestion. In eustress, bowel and bladder habits are normal and regular. What do current scientific investigations reveal about distress and our bodies? Both acute and chronic stressors have been known to be interwoven and to have cumulative effects with regard to some disease processes. Both acute stressors and chronic stressors can cause harm when a negative emotional response is elicited. This leads to the activation of the sympathetic nervous system and the hypothalamic pituitary axis. That's our fight or flight hormones. When they kick in, then that can lead to overall overuse of those systems and body decline. And it's complicated if we've already established a pattern of inadequate health maintenance for our body. A few of the conditions that stress contributes to are colds, depression, slowed wound healing, infections, arthritis, asthma, and cardiovascular disease. If you have a job that you perceive as hectic or highly demanding, and where you don't feel like you have individual decision-making opportunities and personal freedoms, those are environmental factors that also lead to what we call job-related stress, which is a form of distress. So the idea is to start having a better idea of what distress and eustress feel like in your body. So I've given you some things to watch for and feel for.
Your next steps.
Your action step is to pay attention. And when you feel something that piques your emotion, either good or bad, ask yourself, okay, is this stress? If so, is it distress or eustress? If it's distress, is it truly a threat? And can I cope with it? And record that in your journal. I'd love to have you go to drloribarr.com and leave me a voice message and let me know how you're doing and what questions you have about stress.
Psst, be aware. Vitality is an inside job. Trust your spirit, make up your mind, and get your body in gear. There are no second chances.